Hi everyone. I would like to discuss with you today the question of when to buy a nursing bra, how many, and if there's just a better time to buy. Should you already feed? Is it fine for pregnancy? Because we get these questions so often, and I thought it would be best to discuss so that you can also refer back to this if it's maybe applicable to you only a bit later. So there actually is no incorrect or correct time because it depends on the need of every different mom, and everyone's journey is so individual that everyone's answer will be different. And the reason I'm saying that is some women change tremendously in the first trimester. Others stay more or less the same, and they change a lot in the end. And then there are the very few lucky ones that almost wear the same size throughout. So a good rule of thumb to use is if you feel uncomfortable and you are going to spend money to buy either a different bra or undies, it would be a good time to consider maternity options, because the longer you feed again afterwards, after birth, the smaller you'll become again. So if maybe you're 13 weeks and you're thinking, how can I buy now and still use it in 7 or 8 months' time? The answer to that is, as I mentioned, the longer you feed, the smaller you get again. So even if you do buy it earlier in pregnancy, and it might be too small again, let's say between 30 to 40 weeks, or the first 6 weeks after birth, your breasts are quite full and you feel this doesn't fit, you obviously your body gets back to its normal shape again, the more you feed and the longer post-birth. So you might use it again when baby's 4 months old or 6 months old or even 2 months. So it's never a waste of money. And then just something to keep in mind. The first 6 weeks post-birth, any mom, doesn't matter if you've given birth once or if this is your 5th child, your body's learning how much milk to make for this particular baby. So your breast tends to be overfull just for your body to make sure that there is sufficient amount for your baby. But also it's learning how often you'll feed and how much this baby feeds. So after 6 to 8 weeks, sometimes even 10 weeks, production stabilizes and your breast almost goes out of that phase where it's engorged and then emptier after feed and engorged. So that changes, and it is normal for a nursing bra to sit quite tight or to fit just in that time. It's also normal for it to be slightly too small. But as I mentioned, the longer you feed, the smaller you'll become again. And it's not only cups, it's also around the chest, because your rib cage expands during pregnancy because of blood flow and oxygen in the lungs, obviously, but also your actual tum takes up a lot of space. So especially if you tend to be slightly shorter or you've got a shorter torso, obviously the more forward and the bigger your tum is, the more it pushes up against your breasts, and it actually takes up space in your bra. So that would require a bigger garment, which afterwards will fit again better once you've shrunk a bit and fed. It's actually quite normal for a year after, if you tend to feed quite a long time, that you might even need something smaller than what you're used to. So that's totally normal. I think the name of this game is, it's individual and there are no rules. And the rule of thumb that you as an individual need to work from is, if you start feeling uncomfortable and you're going to spend money, then get something in the maternity department, because you'll always use it again.